Now, the treatment is going to depend upon the underlying condition that the patient is suffering from. So once you have a definitive diagnosis, you can move on towards making a management plan for the patient, which is also relating to the improvement of the overall lifestyle of the individual. So it is going to depend upon the associated set of signs and symptoms that the patient is suffering from. Person with dementia can have interventions for the cognitive symptoms and maintenance of functions, which can be obviously medical in their nature. We can use a range of drugs, pharmacological drugs, for instance, for Alzheimer's disease, drugs for non-Alzheimer, dementia, and mild cognitive impairment. So basically, the diagnosis and the underlying condition has to be treated first of all. The non-pharmacological intervention can also be referred to. For instance, you can opt for the CBTs, that is the cognitive behavioral therapies. Counselings are done for the patient. And sometimes patients really respond to these counseling sessions and they are coupled up with the pharmacological techniques, and the overall outcome is very good for these patients. Now, interventions for the non-cognitive symptoms and challenging behaviors include the non-pharmacological interventions. And obviously, we have a range of pharmacological interventions for these symptoms as well. Behaviors that challenges and which basically require an urgent treatment. For instance, if a patient is suffering from delusions of paranoia or extreme hallucinations, you can opt for certain range of drugs which would prove quite helpful for these patients. Now, interventions for comorbid emotional disorders, and it basically gives you an overall view regarding the psychosocial interventions for the comorbid depression or anxiety. Antidepressants can be used, and you can also opt for the anti-anxiety drugs in this particular case. Pharmacological interventions for the comorbid depression can be opted for as well. So it's usually a coupling up therapy of pharmacological interventions, and along with that, you move on with the CBTs as well for these particular patients. So overall, in this lecture, we basically comprehended what are the underlying pathological conditions which can result in the states of the loss of memory, as well as cognitive behavioral disorders, coupled up with the motor disabilities, language problems, as well as problem-solving techniques are also affected in these individuals. And how would you make a definitive diagnosis in these cases and move on and make the underlying conditions more visible and treat and manage the patients accordingly? That is the end. Thank you for watching sqadia.com.